Hi, we're going over the Modern Dental Assisting book today, chapter 25, which is ergonomics. Ergonomics is the adaptation of the work environment to the human body. The scope of ergonomics in dentistry is significant, and it's an important topic to obtain the knowledge and practice the skills before it affects you. So the goal is to help people stay healthy and at the same time perform work more effectively by changing the workplace design. So they do that by modifying instruments, meaning in dentistry, the handles might be bigger so that you're not gripping such a small item and making your hands sore and tired. Strengthening your muscles so that when you are sitting in positions for a long amount of time, it's not making you so tired and overworking your muscles. Taking breaks when you are working on a patient. Small breaks can help ease tension and strain in your hands, muscles, and wrists. Using certain products can also help to reduce strain, like cheek and mouth retractors or mouth props can help with patients, and providing proper training on ergonomics is very important. Musculoskeletal disorders such as headaches, neck and shoulder pain, back pain, and carpal tunnel syndrome account for a very large amount of these disabling disorders, and they are potentially career-ending for musculoskeletal disorders among dental professionals. So you have to keep things in mind like your posture. So when you are sitting, you need to think about sitting properly. You think about sitting in the proper position, which we're going to talk about in a little bit. Think about the equipment, where it is located at. Make sure it's located somewhere that you are not straining to reach the equipment, and that you're not reaching behind you or too far to the side of you to reach any of the equipment, because all of that repetitive motion, reaching off to the side too often, is going to cause strain on your body and over time cause problems for you. So members of the dental team usually perform their work in a seated position. In that position, it should be the neutral position. In the neutral position, you'll be sitting upright with your body weight evenly distributed. Your legs should be separated and your feet flat on the floor when you're working as an operator or administrative assistant. If you're working as a dental assistant, they should be flat on the footrest on the assistant's stool. Your back should be pressed against the back of the chair for lumbar support, and your hips should lean forward to rotate your pelvis backward. Your properly aligned spine resembles a gentle S. When the spine is properly aligned, the ears, shoulders, and hips are in a straight vertical alignment, providing balanced support and equal distribution of weight throughout your spine. And go ahead and try and sit in this position and see how much more comfortable it feels sitting properly. Now, you see that that feels more comfortable because it is a more relaxed position. So these musculoskeletal disorders can include back pain, joint pain, neck and shoulder pain, hand and wrist pain, and headaches. Pain is what alerts your body that an imbalance exists and that an injury can occur over time. So at the first sign of pain, you should inform your employer and take steps to reduce that musculoskeletal inflammation and facilitate healing. So some risk factors in the workforce that are related to posture is that it affects the ability of you to reach for, hold, and use equipment and how long you can perform a task. So being in the ideal way to work would be the neutral position. If you are deviating from the neutral position, meaning leaning forward, twisting to the side, overbending, or reaching, that's going to cause you problems over time. Reaching movement should only be to the front, not behind you. If you have something behind you that you need to stand up and turn around or spin your chair so that you are faced behind you to reach that item. You should not be reaching your arm behind you because that will cause shoulder problems over time. So there are studies by the Department of Labor that provide strong evidence of a relationship between posture and neck and shoulder pain. There's repetitive motion, overflexion, and extension of the wrist can significantly increase the risk of cumulative trauma disorders, which are called CTDs, particularly when the task requires force, which it does often when you are doing tasks related to dental assisting. To help prevent these CTDs, periodic breaks and alternation of difficult procedures with less stressful procedures are recommended. And what they mean by that is typically in the dental office, when we schedule procedures, we'll schedule something that is a harder procedure followed by an easier procedure. So say you may have like a bridge scheduled. So you do the bridge prep in one appointment, and then at the next appointment, you might have a filling. There's a smaller filling. So then you have one large 3-hour appointment and you have a lot of stress and tension on your body. Then the next appointment is maybe a 40-minute appointment and it's a lot less stressful and less tension on your body for that appointment, and it kind of gives you a break. And then you'll have another larger appointment after that. So they alternate the appointments to help relieve some of that stress on your body. So carpal tunnel disorder or carpal tunnel syndrome is very common among dental professionals. When you are working with your doctor, if you do have a few moments, even if it's a 30-second break, make sure that you are flexing and extending your fingers, rotating your wrists, and try to get in some of those little exercises that they have on the pages in this chapter in your book. It's very important to get those little exercises in and to relieve the stress and tension from your wrists and fingers. Carpal tunnel is an anatomic area of the hand and wrist. If you have improper motion, the tendons will swell and exert pressure on that median nerve. It's painful tingling in one or both of your hands. You will get decreased ability and power to squeeze objects or make a tight fist may follow. In advanced cases, the femur muscle located at the base of the thumb might weaken, causing a feeling of decreased strength in the hand grip. This is something that is very common among dental professionals. So braces can be worn that will splint the tendon, preventing movement, and that will allow the tendon to rest and recover from the stress of the repetitive motion. So again, doing these exercises that are in this chapter in this book are very important and will help to relieve a lot of this stress and tension and can help to avoid symptoms of carpal tunnel syndrome. With gloves, you're going to mainly be using ambidextrous gloves, meaning they can be worn on either hand. That can put excessive tension on the hypothalamic eminence, or that fleshy elevation on the palm side of your hand that is in between your finger, your index finger and your thumb. So that will put force on your hand by working against the vertical alignment of the glove. If you're using right-left gloves, ones that are properly sized for each hand, like the right hand goes on the right glove goes on the right hand, the left hand glove goes on the left hand, that supports the hand in the neutral position, which properly aligns the thumb, the index finger, and the middle finger. However, you're typically not going to be using those gloves. Those are used for sterile procedures and surgery. So most of the time, you're going to be using ambidextrous gloves. So remember not to wear gloves that are too tight for you. It's very important because that will put more stress and strain. Also, those gloves will break easier because they are too tight for you. You also don't want them too big for you because that can pose a risk. But you do want to have a little bit of room in your gloves. For muscle strengthening exercises, stretching and strengthening the muscles that support the back and neck and those used in the forearm, wrist, and hands will help them remain strong and healthy. So, like I said, stretch periodically throughout the workday. Before beginning any exercise program, though, you have to check with your physician, particularly if you experience pain with any of those movements. Now, on page 338 in box 25-1, there are several strengthening exercises that I do recommend that you try. Try these at home and get comfortable with them so that you can easily do them at work. With hand relief, resting your hands frequently is believed to be one of the most important factors in preventing carpal tunnel syndrome. Regular hand exercises also can relieve strain. Now, we had these exercises hung up in the offices that I worked in our break room. So I often did these hand exercises in our break room, and I truly believe, or not just in our break room, but I learned how to do them from them hanging in our break room. And I did them often while I was working in the office. And I truly believe that the reason that I do not have severe carpal tunnel is because I did these exercises. It is very important to start these as soon as you start your career and continue doing these throughout the rest of your career. With eye exercises, it's also important to relieve eye strain because if you are straining your eyes at one depth of vision for long periods, when you look up from the task and focus your eyes at a distance of about 20 seconds, for about 20 seconds, it's going to relieve that strain on your eyes because you're constantly, looking at the mouth very close to you, and it's going to cause a strain on your eyes. So get up, you don't even have to get up out of your chair. You just, when you do have a break for 20 to 30 seconds, just look away somewhere far away across the room and just let your eyes relax. Practice that frequently throughout the day and use your full range of vision. That's going to lessen your eye strain and it can help reduce headaches. With back and shoulder relief, to help relieve stress on your back, neck, and shoulders, try that full back release. That full back release is also in your book on 339. So that feels excellent. You're going to let your head roll forward slowly while you're sitting up. And then you're going to allow your arms and head to fall between your knees. So you're going to kind of roll down. Hold that for a few seconds while your whole body, like you're kind of like laying your body on your lap and your head is between your knees. Then you're going to rise slowly by contracting your stomach muscles and rolling back up and bringing your head up last. That is just going to kind of like, as you're going down, you're going to breathe out. And as you're coming back up, you're going to breathe in. And you're just going to let all that stress out. And then you're going to breathe a nice, refreshing breath back in. So your shoulder shrugs can stretch and relieve shoulder strain. So these exercises can be performed in the work setting, and it's very important that you do so. So the shoulder shrugs can just be done by raising your shoulders towards your ears and then slowly rotate then your head back and forth. So it's important, like I said, to take care of your muscles, your body, your joints. If you're not taking care of yourself, you're not going to be able to take care of anyone else. And that is what we do as dental assistants, is take care of other people. So the word ergonomics itself comes from the Greek word ergon, meaning work, and another word nomos, meaning law. So ergonomics itself meaning the law of work. So we're trying to make sure that we are not going outside of those laws of work and hurting ourselves. So just be careful that you are following this chapter well and that you are taking care of yourself properly so that you live a healthy,